Hey guys, welcome back to another video. This is Brad, student physical therapist assistant, and I'm just here passing down my knowledge from what I'm learning from the PTA program. And in today's video, I'm going to be talking about upward rotation of the scapula and then also the scapulohumeral rhythm. And so let's bring this down here to my beautiful drawing here. So we're looking at, this is the scapula, of course, on the posterior side. And so we're looking at upward rotation here, and that is where the scapula is moving this way. And this motion is where the inferior angle of the scapula moves laterally and upward. And this motion is crucial to allow the shoulder to flex, where the arm is perpendicular to the floor here. So the floor being here, and the arm is perpendicular this way. And so about 180 degrees is what you're looking at there. And so the key muscles that are involved in this movement include the serratus anterior, which helps protract this scapula, kind of moving it around and forward. And then we have the lower and upper traps. And with these muscles working in coordination together, this would be a great example of what a force couple is. And so the force couple is when multiple muscles work together to move a bony prominence or cause a motion at a joint. And
yeah, also someone to act up the thingy.
Okay, and then the main bones involved include the scapula here, and then also includes the humerus, and then the clavicle would be kind of in front of the scapula here. And so as the humerus is flexing or abducting, the scapula is outwardly rotating, and also the clavicle is going to need to elevate a little bit and then spin as well to kind of get out of the way to allow that arm movement to reach that full range of motion. If the clavicle didn't move, it would make the humerus stick in the same position when trying to move your humerus, flexing it or abducting it. And all right, cool. The reason why the scapula elevates moves us into talking about the scapulohumeral rhythm. And in simple terms, this means for every 2 degrees of abduction that the humerus does, there needs to be 1 degree. So I'd write, let me turn this around real quick, 2 degrees here, 1 degree rotation here. So every 2 degrees of the humerus abducting, the scapula needs to rotate 1 degree as well, which would move this. So kind of as this one's, here's the scapula here, here's my humerus. So as this is going this way, the scapula also needs to move out of the way, which is tilting the acromion bony process of the scapula away from the humerus. This is a good example of the acromion being in the way. So if we didn't have this scapulohumeral rhythm, then this acromion going to be blocking the head of this humerus here, and that will cause an impingement. And what that impingement does is it affects the supraspinatus tendon and the subacromial bursa, which leads to pain and inflammation, and it's also known as shoulder impingement syndrome. So understanding the upward rotation of the scapula and the scapulohumeral rhythm of every 2 degrees of the humerus moves, the 1 degree of the scapula moves to move that bony prominence out of the way. And this is vital for athletes and physical therapists or anyone looking to maintain healthy shoulder mechanics. Thank you for listening to this video.